At Eastern Virginia Medical School, we teach tomorrow's medical and healthcare professionals to become the leaders and healers of the future. Located in the heart of Norfolk's historic Ghent neighborhood, our campus sits on the largest medical complex in the coastal Virginia area. As resources for our community, these healthcare facilities provide excellent opportunities for our residents, with access to world-class doctors and a variety of unique pathologies. The EVMS Psychiatry Residency program offers more than an opportunity for mentorship and experience. It is your chance to train with the best in their disciplines. At EVMS, we're making the future of healthcare a reality today.
My primary motive for being a psychiatrist here was to teach residents and to provide education and to be a part of that growing experience. Being a program director allows me to be very focused on that, and it really provides me joy in what I do every day. I've been faculty at EVMS for about 10 years, and prior to being faculty, I was actually a medical student here, which is one of the reasons I came back. I really loved my med school experience.
EVMS's program is perfect for people who are really interested in a small program where they can make a difference, where they can make a change, where they can make an impact.
It is an academic program, but it's a small academic program. And I think we really shine where residents can get to know their faculty one-to-one.
We keep things very real, for lack of a better word. It breeds a trust between all of us, and so it's very camaraderie.
And it's very easy to collaborate with other departments here at EVMS. I think psych has a great reputation here and is a valued service here in our hospital and amongst other departments.
From the start, you're seeing patients, you're deciding, assessing what's going on with them, diagnosing, planning, and then running all these things by your attendings. And I think one thing that I really appreciate here is you get a lot of autonomy. Usually it's just you and attendings, and so you're sort of running the unit and then just going to them for advice or help.
And to an extent that was a little bit terrifying, as a new intern, but it was also very encouraging and motivating.
The program is structured in a very standard way, like most residency programs for psychiatry are. The first 2 years are inpatient, and those inpatient rotations include rotations in acute inpatient psychiatry settings, less acute psychiatry settings, VA psychiatry. In first year, we also do neurology and internal medicine. Then during second year is when we start to do some more subspecialties within psychiatry, which include addiction medicine, child-adolescent psychiatry, substance use. So then into third year, that's when we start doing outpatient work. And that's essentially at the different clinics within the community. And fourth year is mostly focused on different electives and getting us prepared for being attendings.
We have a couple excellent resources. Centera, where we're able to have some of the most medically complex patients who are able to help with our mental health care on our consult liaison service. And another huge resource is the VA system here, where we get exposure to everything from addiction to complex inpatients, as well as some really complex outpatient care, and with many mentors there at the VA hospital. So tremendous resources in our community.
One of the things I loved most, especially because I was interested in child and adolescent psychiatry, is our close affiliation and connection with Children's Hospital of the King's Daughters. It's literally across the street and it's on our main campus. And so during our second year, we have a child and adolescent psychiatry rotation there, inpatient, and we also rotate through the clinic as well, outpatient, during our third year.
Right behind me, we have a children's mental health hospital that is being constructed, and our psychiatry residents are gonna actually get to rotate there and actually have the potential to go into child and adolescent fellowship and really be those active providers in taking care of our children who have mental health needs as well.
I think the biggest thing is when you're a resident, you learn as you're doing and as you're going along. And I think that's the biggest plus side of this program, that it's challenging and it's giving you, a good set of work and a large set of patients that are very diverse to learn from. And that's one of the keys to being successful and gaining that amount of knowledge in residency.